Have you ever lied to your doctor? Yes? Then you're not alone. The shocking truth is that according to research, 40 to 80% lie or withhold important information from their doctors at least occasionally. If you want to know why, then stay tuned because I will reveal 10 surprising reasons why they do it. My name is Stefan Buntrock. I'm a board-certified urologist and sexologist. And yes, I know that patients lie to me. Sometimes it's a bad thing because it prevents proper diagnosis and treatment. Reason number one is fear of judgment. It's a big problem, especially in my specialty. I am dealing with taboos day in and day out. I know that people lie to me about sex. It is because they don't want to be judged for their lifestyle choices. They don't want to be criticized for smoking or drinking. You know, it's just like on YouTube. Whenever I say in my videos, don't smoke, I get comments from annoyed viewers. Reason number two is embarrassment. Oops, which part of the body would be more prone to embarrassment than the urogenital tract? So patients would withhold information or just alter it when it comes to incontinence or sexual health. But also, mental health is an issue. Psychology plays an important role in sexual function. Depression is a classic in men. Some patients are so depressed, they come crawling into my office. But when I address this, no sir, no problem at all. Reason number three is desire to avoid lectures. If you don't exercise, you smoke, and your diet consists of burgers, pizza, and Coke, you know what's coming, and you don't want to hear it. So you alter the truth a bit. Reason number four is fear of diagnosis. Some patients fear the potential outcome of a medical evaluation. I can totally understand that. Nobody needs bad news of this kind. But sadly, it doesn't get any better by withholding crucial information. Reason number five is denial. This is a typical reaction when there's a problem to accept a certain issue. For example, everybody knows that smoking is unhealthy, but most smokers imagine they won't be the ones affected. And when they finally get a related diagnosis like bladder cancer, they are stunned in disbelief. Reason number six is avoidance of treatment. Let's take an enlarged prostate, for example. Your prostate is enlarged, you feel miserable because urination has become your new unwanted hobby. Finally, you consult a urologist, and you know what he's gonna say. Surgery. But you don't want that. So you tell him you are not bothered by your peeing around in the least. Reason number seven is linked to cultural or social norms. In some cultures or social groups, discussing personal or sensitive health topics may be considered inappropriate. I mean, just look at male role models. It sometimes makes my professional life harder than it could be. Like if I assess the pelvic floor and I obviously find a trigger point, I ask my patient if it hurts because I want to establish that finding, and he goes like, no! Reason number eight is misinformation. Patients may lie unintentionally if they believe incorrect information about their condition or treatment. They assume that their doctor will agree with their misconceptions. Reason number nine is memory issues. It happens frequently in older adults or those with cognitive impairments. They might not fully remember their symptoms, treatments, or medical history and inadvertently provide false information. Reason number 10 is concern about insurance or legal implications. Or like here in Germany, when someone's in the probationary period for a civil service career. Patients may lie out of fear that certain information could affect their insurance coverage, employment, or legal standing. So what do I think as a doctor? It is my advice to patients to look at it from my perspective. I have worked in healthcare for decades. I have talked to thousands of patients. I have seen things and been through scenarios you wouldn't be able to imagine. I take no personal interest in what patients tell me. I want to know the facts for my diagnosis and treatment. That's it. I don't judge my patients. And this is how doctors are taught to work. I have seen over 30,000 penises, some of them in pretty bad shape. So I am usually not affected by what my patients tell or show me. I think it helps patients if they realize that doctors have a different view on things because of daily routine. Have you ever withheld something from your doctor? Tell me in the comments. And while you're at it, hit the subscribe button and give the video a thumbs up. Thanks for watching. Bye-bye.